Let's talk infections with breast implants. How do we diagnose them and how do we manage them? Anytime an implant is in place, if you're operating anywhere in the area, even if you're not operating on the implant, that implant is at risk for infection. And it's more likely with thin tissue like a mastectomy. So diagnosis of infection can actually be challenging because they don't always present as an obvious infection. Redness and blotchy redness is actually pretty common after surgery and usually isn't an indication of infection. It just can be inflammation. Especially with thin tissue, you'll see blotchy redness. You also tend to see what we call dependent erythema, where you get some redness of the lower portion of the breast, and this is all just normal healing. So figuring out when it goes from normal to infection can actually be challenging. And the way we do this is we just watch. Normal things don't get worse, infections get worse. Now, most of us will start you on antibiotics if there's concern, because if it is something mild and superficial, we want to see if we can stop it so it doesn't continue to spread. But to be frank, if it's around the implant, there's really no way to treat that with antibiotics. It's something that just is going to require surgery. Now, the antibiotics we usually start you on are things that cover skin flora, so things that would typically be at risk for causing an infection with surgery in that area. And oral antibiotics are our typical choice. So Keflex, Bactrim, clindamycin would be the typical things that surgeons would give you. And remember that you don't need IV. People think since it's an implant, it's a severe infection and needs IV. That's just not true. If you have a working gut system, the appropriate antibiotic is the one that treats the bacteria. It doesn't have to be IV or PO. And PO is much more readily accessible and it works great. Now, say that things are progressing. The breast is becoming more swollen. The breast is becoming more red. You as a patient are feeling ill. What do we do now? There's really two different paths. So there's get the implant out, let everything cool off path, and then there's the implant salvage path. Now, I personally, full disclosure, speak on the subject of implant salvage occasionally. So I tend to be more aggressive. This is something I do in my practice more commonly, but it is certainly the most conservative option to just remove the implant. So if that's what your surgeon suggests, go with what your surgeon says. Don't try to bully them into saving it. But here's my algorithm. If the patient has clearly a concern for infection and they're not sick, then I typically will attempt implant salvage. And what do I mean by sick? Do they have a high fever? Do they have malaise? Do they look bad? Are their vitals abnormal? I look at the whole picture with the patient and determine how I feel about how that particular person looks, and do I think they can have a salvage attempt. So if I'm going to attempt implant salvage, here's the steps that I personally do in the operating room. So step number one, we open everything up and we do cultures, and I'd like microgen PCR because most of these patients have been on antibiotics because we've been worried, and things don't grow very well on culture when you've been on antibiotics. So I send a PCR. Implant comes out and it goes in the trash. We don't use the same implant. You can't soak it in betadine. That implant is infected. Then I remove any mesh or prosthetic materials, dermal matrix that may be present. That goes out. Scrub the cavity with a scrub brush, pulse lavage, and then I irrigate with 50-50 mix of betadine and saline, allow it to sit for 10 minutes, irrigate it out. Then goes the implant over a drain, and up goes a bunch of phase 1 hypochlorous solution to sit in the cavity for 10 minutes at the end of the surgery before I let it out. And then I continue patient on broad spectrum antibiotics that cover the most common things that I see in my practice that cause implant infections. Now, in my practice with my algorithm, it almost always works, but I'm very careful with who I choose to attempt implant salvage. And you get one shot. So we try one shot at implant salvage. If it doesn't work, then the implant comes out. Once the implant comes out, we treat you with antibiotics, allow the area to heal and cool off, and then place an implant back. It's usually 3 to 4 months after implant removal. So that's just a quick review of how we treat implant infections. In general, you cannot treat an implant infection non-surgically, and it can be challenging to diagnose because many patients have symptoms that appear to be infection that indeed are just normal healing. So the key is follow the patient. Do they get better? Or do they get worse? If they get worse, take them to the operating room, and then you choose whether you remove the implant or attempt implant salvage and wash it out and place a new one.